You need, can we close the door? Thank you. Good afternoon. I want a good spirit for Ilongse. Good afternoon. One more time. Good afternoon. Very nice. All right. Welcome to Thailand. For those of you who are not here, my name is Prof. Rangsima Wanit Desha. I'm a dermatologist, born and raised here. And today, we are so proud, and I would want to thank Sinclair for bringing Ilongse to Thailand. And this workshop will be full of 60 minutes with content and what you want to learn with Ilongse. So with me, I bring 3 handsome guys because I want to be the most beautiful people on the stage, as always, and also a good friend of mine from 3 different countries. So the first one and the first speaker, he is also my teacher for using Ilongse. When we launched Ilongse in Thailand, he was the speaker that we choose because we want to learn from him. He had a wide variety of experience using Ilongse in multiple indications. And today he will tell you what is the importance of the anatomy to Ilongse and how you can utilize the use of Ilongse. He is Dr. Chang Lilin. He is a dermatologist from Taiwan. The second speaker will be from Korea, Dr. Kitae Kim. I'm so sorry, my pronunciation in Korean is not that good, but he is only one and only plastic surgeon on stage. Of course, he will tell you, since he is a plastic surgeon, he will show you how to correlate all the structure and technique from the side of plastic surgeon. And last but not least, I have a good friend of mine, Dr. Rasapum Sumetiwit, who had no need for the introduction, especially for Thai people. He will charm you with the technique that you can use combination of Ilongse, maybe with all other technique, including fillers. And since I already had introduced all of them and the topic that they're going to go over, so to how would I say, to speed up the time, all of the speaker will come up on stage and then give a 15-minute presentation, and we will keep Q&A or discussion at the end of the session. So without further ado, may I have Chang Lilin.
Thank you, Dr. Rangsima. And good afternoon. You don't need to respond loudly. Let's just begin. Okay. This part is going to give you a little bit different perspective when you are using Ilongse, because now we have more and more collagen stimulators on the market, but they all stimulate collagen. But what we want is more than stimulation of collagen. What we want is to utilize the properties of the product and combine with our knowledge of anatomy to achieve the result more efficiently. So this is the topic I'm going to talk about today. So first, it's an interesting question. Does a filler always volumize? Because in the past, we use mainly the fillers to fill, to provide volume. But in addition to that, we are no longer just use it to fill certain lines. Most importantly, we, in addition to volumization, it will be great if we are able to support some of the facial areas that changes in the aging process. And also, we can create some lifting effects. And if we can achieve some face slimming effect, that will be perfect. But to be able to do that, we need to know the anatomy and to know about the product, because not every product is able to achieve the exact same result. And with our knowledge combining the anatomy and the product, we should be able to inject less and inject smart. So let's talk about the support and the lift and slimming the face. So to be able to support the tissue, usually we place the product on the bone, supraperiosteal injection. And to be able to do that, of course, the product needs to be able to support the soft tissue above it. And if we want to achieve certain lifting effects, that's more than support. ideally, we should be able to place the product in some of the interfascial plane so that we can try to create some lifting effects and even have some repositioning effect through our injection technique. As we age, our lower face becomes heavier and heavier. So if we can do it correctly, maybe we can have a slimmer face. But to be able to do that, we need to think about which plane we want to place the product. There are a lot of facial areas that have these interfacial plane. So if we can manage to utilize the interfacial planes wisely, then we think we can have a very surprising result. So for Ilance, I think it has very different property compared with other available products on the market. So it has higher viscosity. So naturally, we can use it to support, to create some lifting effect. And if we do it correctly, we can even to have a slimming face effect after placing the product. And Ilance is a product that gives you precision because it doesn't migrate. So if you place the product with precision, you not only have immediate correction, and through the stimulation of the collagen, and doesn't migrate, so you can keep the shape very nicely, including the forehead reshaping, nose reshaping, chin reshaping, and most importantly, even in the interfacial plane, it doesn't migrate. So let's talk about how do we achieve such result by using these crucial lifting zones and by using the product in a more saving way. So in the aging process, as we know, every single layer of our structure ages. They age differently. Our bone gets smaller. So in certain area, the size and the shape of the bone changes. And interestingly, recent researchers also shows that our muscle loses volume as well. It doesn't mean that we need to inject into the muscle, but if we keep this in mind, we are able to place some of the product maybe above the muscle to support the structures to compensate for the areas that you lose in the aging process. And of course, deep fat, we loses volume. Everybody should already have a very clear concept about that. So for different facial area, we loses the volume over time, and it combining all the factors above, we loses the support to our superficial soft tissue. So when we are treating certain aging sign, we are no longer seeing this as a single aging sign, but we need to think about what actually happens behind this. For example, if we see a temporal hollow, we need to think about the bone resorption, the temporalis atrophy, the temporal fat loss. And if we are tackling the mid-face descent, deepened nasolabial fold, what we should have in mind is the deep medial cheek fat loss, maxillary retrusion, which leads to the pseudotosis of superficial fat. And for tier 12 and lifted junction lengthening, it works pretty the similar way. Even for the jowling, periorbital, perioral area, it's all the same. It's just we need to figure out what are the structures that are relevant to this. And most importantly, if we have a look at the surgical area and to have a look at some lifting technique that involves different facial planes. And of course, if we are doing a surgery that involves dissection and fixation, but if we look at the categories of these lifting techniques, for the thread lifting, in the categorization, it is no release technique. So with filler, it's acting pretty the same. So if we are trying to make the best of the interfascial plane to achieve certain lifting effects, we also need to know what we can utilize for this gliding plane. So if we have a look at the gliding plane of the whole different facial area, for different facial areas, they pretty much all have this gliding plane, including the premasseter space, the prezygomatic space, premaxillary space, and temporal area. So these areas, they all have this alveolar tissue that we can utilize when we are trying to create some lifting effects. So for different facial area, we need to figure out what's happening in the underlying structures before we are able to place the product correctly. And if we manage to place the product correctly, for the upper temporal area, we are able to not just to restore the volume loss, but also to have some brow lifting effects. And the lower temporal area is pretty much associated with the mid-face lifting effects and also some of the improved definition for the lower face. And zygomatic area as well as the preauricular area and maxillary area. The maxillary area is associated with the perioral proportion. So every area has its role in terms of the restoration of the facial proportion. And for this gliding plane, in the preauricular area, it's particularly interesting because it involves the premasseter space. So let's have a look one by one. So for the temporal area, as we know, there are several layers that we are able to place the product. And every layer has its own role. For layer 2, subcutaneous plane, it's more for volumization. For interfascial plane, we can use it for lifting. For the areas for the position on the bone, especially the area just lateral to the temporal ligamentous adhesion, it can be very efficient for brow lifting and change a little bit of the facial proportion. So if we can manage to place the product in these different layers with proper technique, we can actually achieve very nice results, including the lower temporal area. If we can place the product in 1 layer, 2 layers, we can all manage to have very different lifting results. So in this case, for the forehead and temple area, she received 4 cc of Filance. So what we can see from here is not just to volumization of the temple area, but if we appreciate the whole facial shape, we can see the lower face becomes slimmer, and also the facial proportion changes as well, in addition to the brow lifting area. So the temporal area plays a very important role for the whole facial proportion. And on this oblique view, we can see the improvement of the jawline definition as well due to the re-support of the temporal area as well. And if we look carefully, we can even see the brow lifting effect very nicely by just volumizing the temporal area very well. And for the zygomatic area, the structures that is associated with the lifting result is actually the lateral sheath and the medial sheath and the zygomatic support. And for the sheath area, in the publication, it says that if you start from the area lateral to line of the ligament, that not just provide some lifting effect, but also that can reduce the amount you need for the central facial area. So that can make your product use very efficient. So let's have a look at this case. I didn't use much, just 1 cc for both sides. And by placing the product in the lateral sheath and a little bit of the medial sheath, this is the result we get. It has a very nice slimming effect, and we can create a facial shape that to our Asian people's preference. And the preauricular area is even more interesting because it, as I said, it involves some the premasseter space, which is a loose connective structure, and it's bounded by the ligament and also the zygomatic arch. So with the proper technique, we can achieve the lifting results pretty in the direction that what we do with this actual surgical lift. But of course, the extent of the lifting is different. But we can definitely achieve such lifting result by placing the product properly. For example, these loose connective structures, if we want to compare to, it's very similar to the millfield. So technically, this layered structure, if we manage to put something in between layers and stick them together, we can prevent it from migration. So let's have a look at this case. So we can see if we're trying to reposition by minimal amount of the product with the right layer, right technique, and just 0.5 cc each side. Look how we can achieve the other side is already lifted with less heavier lower face. So that's the use of the preauricular gliding plane and by placing the product efficiently. And if the patient has multiple layer laxity, of course we can use the product more than in just one layer. We can always place the product in the subcutaneous plane. So take this one for example. The face is heavier, so the right side is lower. By placing the product in two-layer fashion, after I release the hand, we can see the other side is very much lifted by using only less than 1 cc each side. So we can combine the preauricular gliding plane, the interfascial plane in the temporal area, and we can have a very nice lifting effect in the very product-saving way. And of course, the millfield, we can stick them together in 2-layer or 3-layer. This one as well, I use the preauricular gliding plane, interfascial plane, and a little bit of the layer 2, 1 cc each side. Look what we achieved. The jowling is very much improved. The lower face becomes much slimmer due to the repositioning effect from Elance, and the jawline definition improved very nicely as well. And for the maxillary area, the idea is similar, but for the maxillary area, it involves the deep piriform space and premaxillary space. So it involves techniques that lift up your soft tissue and place the product in the plane that you want, and then you need to hold it for a while so that we are able to pick up the soft tissue of the mid-face and also the corner of the mouth to have a more smiley face. Let's look at it again. Okay, so we don't need much. We only need 0.2 to 0.4 product each side, and then we can change the contour, but also resupport the muscle in the mid-face, and then have a very nice lifting effects in the maxillary area. And for the deep piriform space, of course, we can change the perioral proportion. It's just 1.5 cc each side in the cannon fossa, and look at the lip eversion, and the shape of the lips also changes due to the improvement of the anterior projection. So in summary, if we want to have such result, imagine you have 2 slices of toasts, and then we're trying to stick them together. So you spread the jam in between the toast slice, and then you release the skin. Of course, to make them stick together, you need to compress it a little bit, and then when you lift it, it's very much lifted. So in this case, I utilize all the gliding plane, including the temporal area, preauricular area, maxillary area, and also a little bit of the zygomatic area. This is the results 2 weeks with only 5 cc, a little bit of everywhere. And this is the oblique view. on this one as well, we can see the facial shape changes very nicely with less heavier lower face and brow lifted. And then, of course, the jawline definition also improves as well. And if you do it correctly, even the submental area and the merit lines can be improved, and a little bit of the jowling can be improved as well. So this is the way to use the product efficiently. And when we can do it very precisely, we can actually slim in the face in addition to lifting the face. So in summary, Elance is not just a volumizer. We need to combine the property and anatomy to make the best use of it, because it's the era of chasing the fold. The lines has already passed. We need to think about our goals and where to place the product and what we are trying to achieve, because the product is in this way is just a tool that we want to make the best use of it. So we can inject smarter and inject less. Thank you for your attention.
Yeah. Hello, everyone. I'm Dr. Gita Kim, a board-certified plastic surgeon from Tech Plastic Surgery in Busan, South Korea. Thank you for having me. Today, I'd like to share a concept I call structure matter aesthetics, and to show you how Elance goes beyond the simply peeling volume and actually helps us rebuild the architecture of the face itself. First, my disclosure, I provide medical advice to a number of the company, including SINCLAIR. As a board-certified plastic surgeon, my main procedure are pack grafting and SVF and laser surgery, etc. I have a particular interest in combination treatment, pack grafting, SVF, and laser together. I've been continuously developing new protocols for many devices and material we use in the aesthetic surgery. This is my resume. First, I will show you a video of standard aesthetics. Elance reconstructs the architecture of the aging face along two axes by refocusing each retaining structure and by refining each contour. If you remember one sentence from this talk, let it be this: we are not filling a surface, we are rebuilding structure. Did you enjoy? Everything I want to talk about today is right there in the video, but my talk have the four parts. First, a paradigm shift, why structure matters. Second, the structure power of the Erlance. Third, the Erlance CL code. And finally, why Erlance? I will explain the first topic, paradigm shift, structure matters. Aesthetic trends tend to move in the cycle from volumizing to energy-based tightening to skin booster and regenerative treats. Yet, our patient expectations are still not fully met because these often treat the symptoms rather than the underlying cause of the aging. So, there is a growing need to redefine aging from an anatomical perspective and to set our goals as a structural restoration rather than superficial correction. In my view, the combination of the Erlance and the SINCLAIR Soft is perfect synergy for exactly that. The limits of the volume-first approach are clear. We see a loss of the definition in the lines and the contour, a heavy, sagging appearance, and a muscular rigidity with a loss of the expression. And ultimately, patient dissatisfaction with the unnatural look. Clinically, this shows up as the overpill, pillow face, and the squirrel cheeks. They so-called frozen face with the unnatural movement. And over time, fibertic change, stiffness, and real psychology dissatisfaction. The old approach viewed aging as a surface phenomenon and aimed at instant correction of wrinkles, volume loss, and texture, which tended to look unnatural and didn't last. New approach sees aging as an anatomical structural collapse, ligament laxity, bone resorption, and fat atrophy. So our goals shift to structural rebuilding through ligamentous support and tissue re-densification, and the structural repositioning through tissue repositioning and lifting. As we age, it's only natural to develop wrinkles, loss volume, and experience sagging. This is a schematic picture about the facial soft tissue layer, but I like to think of the face as a house. The epidermis and the dermis are not roof. The pack compartment, the smooth, and the muscle are the walls, and the bone is the foundation. Holding all of these layers together are the pillars, the retaining ligaments. A house doesn't fail because the wallpaper faded. It failed when the pillars and the found weaken. The aging phase is no different. Structure aesthetics comes together in two steps. First, the structural rebuilding, reinforce the ligament and restore collagen to rebuild the framework. This is where Erlance goes in first. Second, structural repositioning, lifting, and relocation the tissue. This is where SINCLAIR soft thread follow. In other words, Erlance rebuild the foundation and the thread restore the position. Let me show you again. Yes, this animation is make structure matters. Let's move to part 2, the structure power of the Erlance itself. Let's return to those layers: skin, subcutaneous, smooth and mimetic muscle, and the retaining ligament, and the periosteum, and the facial bone can be placed precisely at these deep structure levels, particularly at the ligament and on the periosteum. It is the only collagen stimulator that comes in true pillar form. It means it provides both immediate structural support and long-term collagen regenerative simultaneously. Allance's composition is simple but powerful. 70% of the CMC-based gel carries that provide immediate support, and 30% is polycaprolactone microsphere that drive the collagen regeneration. These PCR microsphere are uniforms suspended in the CMC gel, creating a dual action effect that can last 18 to 24 months. Alance works in a peak-to-evoke pattern. As you know, the process of the CMC decreasing and the pH loads increasing can overlap, leading to a unique structure rebuilding. A traditional HA filler picks the moment it injected, then paid as enzyme break it down. The curve starts at the top and only go down. Alance behavior difficultly. In the early page, the CMC carrier supports graduate collagen remodeling in the surrounding tissue. And in the improved page, the collagen integrated into the tissue, enhance the correction and improving skin quality. The result is a benefit that extended well beyond the lifespan of the conventional pillar. Go a little deep into the science. Alance's high G prime, its storage modulus, provide a robust and stable tensegrity stimulus. The data show the Alance M has G primes of about 841 of 51 pascals, roughly 2 to 3 times higher than the reading high molecular weight HA pillars. And that firmness is exactly what gives it the strength to hold structure. Alance's regeneration goes beyond the collagen alone. As a PCR-based material, it forms a regenerative scaffold within the subcutaneous adipose tissue, activation local stem cell pathway, and driving overall extra matrix or ECM remodeling. This restores not only collagen, but also elastin, then hyaluronic acid, improving tissue structure elasticity and hydration. Now to part 3, I'd like to explain the CL code, the new Alance treatment code based on the structure aesthetics. CL code contribute to 2 codes, C for the controlling code and the L for lifting code. Them together, and the CL code lets us achieve natural control and lift at the same time. Think of it less as the set of the injection points and more as a map of which layer to treat and how much to place build structure. In control code, Alance is placed around the smooth layer to create a uniform volume of the broad area. Beyond the volume, the new collagen also improved the skin texture and the fine wrinkle and the skin density. In the lifting code, Alance is injected into the palm ligamentous fiber tissue that runs from a bone through the smooth to the skin. As that tissue expands, it pulls the surrounding structure upward. And at the subsmart, tissue became denser. The smart at the inject site tighten, lifting everything around it. First, I will explain the C code. The C code is similar to the existing concept. It is designed to reinforce area where volume has been reduced appropriately. As you can see in picture, it proposed the optimal method for restoring volume. Code C compromised 7 code and was proposed to enable a more systematic approach to existing volume augmentation. Now the lifting or L code. The L code can describe as being close to structure aesthetic concept. It is a groundbreaking treatment that achieves a lifting effect by carefully injecting a small amount of into area with supporting ligament. Personally, I believe induced lifting by stimulation tensegrity. Following 8 ligament points, L1 at the superior temporal septum, L2 at the temporal ligament near the lateral brow, L3 and L4 at the posterior and anterior zygomatic ligaments, L5 at the zygomatic cutaneous ligament, L7 at the plastema auricular ligament below the eye lobe, L7 at the mandibular ligament, and L8 at the center of the chin. By the precise targeting each ligament, we lift the tissue upward. Here is a clinical case. This patient received 2 cc using the Erlans L code, compared here with the Bacteria 3D imaging. At 5 weeks post-inject, you can see the mid-pace have lift naturally, and the contour has become more definitely. Notice this doesn't look peeled, it looks lifted. The structure have been raised, not padded. 8 weeks after. This case is a little different. We use HA pillar in area where Erlans isn't suitable, such as under the eye and the rib. We inject Erlans into the tip of the chin and the front of the cheekbone to immediately create the beautiful heart-shaped contour. So to bring it together, why Erlans? Erlans is perfect as it is. It is used to contouring and lifting without any manipulation, never dilute. This treats superficially, but it is collagen stimulation. Because it is the only filler-formed collagen stimulation that gives us immediate support and long-term collagen regeneration in single product. We are moving from an era at the surface peeling on the era rebuilding of the structure. Using Erlans to rebuild the foundation and the silhouette soft restore the position. It is what I mean by structure aesthetic. Thank you for your attention.
Good afternoon. The next topic. I'm sorry. Okay. So the next topic is about Erlans in my own technique and my protocol. I listened to Dr. Lin lecture, so he got me thinking the idea or the concept of coming up the protocol for injecting Elangse. So this is my bio. I think all of you know about this one because I'm running out of the time, so I'm gonna pass through this one briefly. So, while the effect of CMC is decreasing over the time, the effect of PCL inside will gradually. What happened? Oh. Okay, it's gonna be increasing the effect of PCL to be more prominent over the time to take place of CMC. So this particle of CMC, the PCL microsphere, and I think Dr. Lee, Dr. Kim, sorry, mentioned about this one, so I go through this one briefly. So I think I'm gonna go to the protocol in my own SI. I think it should be follow the approaching the protocol in a part of the phase or the whole phase approaching. So I'm coming up with this one. I'm gonna draw two lines to separate the phase. This line from the superior temporal septum and TLA, and then we go to the zygomatic ligament and mesenteric ligament. This is the first line. And the second line is called maxillary ligament on the soluble fold through the mandibular cutaneous ligament. Divide the face into L-zone or lateral, middle, and central. So I'm gonna separate the face, break it down into two portions or two parts. Like for the temporal and zygoma is one. You can inject only one syringe per one part, and the lateral cheek and combine with the jaw angle and the cheek, the mid face, including nasolabial fold. Actually, another part is a buccal. I skip this one, and periorbital, including the eyebrow, and the chin, including the marionette line, and then the forehead, and then especially there's another one is nose. So I break it down each portion into each small part, such as the L refer to lateral, M refer to middle, and C refer to central. And then we have temporal deep and temporal intermediate. So I put the letter deep, subscript mean deep. And at the same level, normal level, I mean intermediate. Or like this one is interfacial plane. This is deep into the bone, for example. And for the lateral zygoma, maybe we have deep pain. We have deep pain, and such as lateral and parotid, superficial subcutaneous, and something like on the cheek. Anyway, there are a lot. So I'm gonna show you the video. And this is a way how to inject in each part. This is a temporal zone and lateral, including mandibular angle. And this one, mid-face, including the lifting and nasolabial fold. And this one for the chin and marionette line. One syringe per one side of the face. And periorbital, including the eyebrow in the roof plane. So totally 1 mil per one side. And temporal, 1 mil per one side. So the case sharing. Gonna show you this case, 48 years old. Some of you know her because look familiar, right? She got some sad look on her eyebrow and eyelids, and some degree of sagging and jowling. So I'm gonna inject this one. Is inject with the basic and intermediate together in her face. So including 3 cc for full face, it means that 1.5 cc per one side of the face. Show you the video. This is a line I draw. This zygomatic and zygomatic ligament, mesenteric ligament, and buccal maxillary and mandibular cutaneous ligament, and the point of basic code with a sharp needle on bone. And this area you have to be careful because of the presence of the artery. Inject on bone, draw back before and inject. This is a 0.2. So I make the syringe to be 1.2 because syringe is 1 cc. I mix with lidocaine 0.2. So totally 1.2 per one syringe. So 0.2. Temporal, deep on bone, and sarcoma, and then mid face. And this angle of mandible, 0.2, and the less, and mandibular cutaneous ligament. And then I have half ml per one side. I'm going to check with the cannula. This one is subcutaneous. So I have 0.6 for half syringe. So I'm going to check 0.3 here in subcutaneous, in fanning technique, and fanning here on the pre-jaw sulcus in subcutaneous also. And even you can go up to emerald line in some case. So I have this one side of the face immediately. So you can see the result right away because of the CMC effect, and you see her eyebrow lift. This before and after. And then I'm going to show you before and after. This one before, this immediately after. And this 2 weeks, her face gets smaller. And the lifting effect, and also the jaw and the eyebrow lifting compared to this side, right? The neck is the same size or no? And look at this angle, the oblique view. You can see the lifting effect. Her face get smaller after the treatment, after the 2 weeks. And if you wait for over the time, you can see the result more and more over the time, right? 4 weeks, 1 month, 2 months, 3 months, like this. And the eyelid lift up. She look happier compared to before. This one before, immediate after, and 2 weeks after. And look at the jaw emerald line. So it means that this case is just 1.5 syringe per one side. So total fat is 3. And then next case, she's 43 years old. She has the sagging here under eye. Actually, she have overfill syndrome before. So I dissolved with HRS on her face before. And then she come to the case for the treatment with Ilangse. So I inject for the full face for her, and including a little bit on the forehead. So totally 11 syringe of Ilangse. So I cannot draw the line like this, the same thing that I did in the first case. So that the line, this line, temporal line, the zygomatic, and mandibular angle, and here, the area you must be careful when you inject because of the presence of the artery. The first syringe by syringe, you see the syringe by syringe, and then zygomatic, and then go to the lateral cheek, the parotid area, in fanning. And then go to the posterior jawline or mandibular angle in subcutaneous fanning. Then I finish one syringe. After finishing one syringe, and go to the second one. Go to the second syringe. Now we go to the mid face. Sharp on bone. And then this one is knee solebial. Now go to the canine fossa with the cannula. Deep to the cannula, and then come up to the superficial, to the nasolabial superficial, and then it go to the buccal. It go to deep fat, to the buccal fat, and do fanning, to finish the second meal, and then, oh, I'm sorry. Do you have the time? Okay, I don't think. Okay, so actually I did for the whole face, including the forehead, and then I finished 11 cc. So this is immediately result after 1 syringe, 2 syringes, 3 syringes, 4, 5, and 5.5 for the forehead. This one because of the effect of lidocaine in the forehead. So she got a dropping a little bit on the middle part of the eyebrow. But look at, she gradually lifting syringe by syringe immediately. And this is the result immediate, and 2 weeks later, her face looked smaller. And the the eyebrow and the mouth corner lift up after the treatment, and the sagging, you see, and also the submental area is improved after the treatment. And we must be follow her for the 1 month, 2 months, or 3 months after to see the result. And we can keep update on this one. And this one, the result, 2 weeks, including the forehead. And this another case, the last one, 67 years old. She has the drooping of the eyelids, of course, excessiveness of the skin, and the jaw, the big jaw in the submental, hanging skin at the submental area. And the forehead, she has the depressed in here and the static lines. This one, I inject syringe by syringe, the first, second, third, and fourth, 5, and then 5.5 syringe for the forehead. I inject only 0.5 per one side. Actually, I should inject at least one syringe per one side. But you see the gradual in terms of the increase, the lifting effect on the jaw fat, and total facial shape here, and here there's the effect of lidocaine again. And this one I approach not syringe by syringe for the full face, but syringe by syringe for each area, such as start from the temporal and sarcoma, and here for the lateral cheek, and then for the cheek, and then for the mid face, and then for periorbital, including the eyebrow and then the forehead. So this is before, immediate after, a little bit red because of the massage and the procedure. And this after, you can see she look lifting, and also the under eye and the jaw, the total facial face look better and look less sagging, including the eyelids and the mouth corner turning up over the time. And here you can see the lifting effect, and also if you notice on the submental skin under the chin, it's improved after the treatment, and her face looks smaller. And this one, and this 2 weeks, and she must be followed, and then I will keep update on the case, and maybe the next meeting if I have the time. And this one, you see, if you notice on the neck and the submental area, the hanging tissue on the submental is improved a lot after the treatment for 2 weeks. So I will show you. This is a few cases more. This is after one syringe of Elance per one side. So for the total face, 1 syringe per one side, her face looks smaller and lift. After the treatment, you see, her face looks smaller, more contour. And then the next case is a male case. His face looks smaller after the treatment for 1 month with two syringes of Elance for full face. It's just basic treatment, sharp on bone, not intermediate or the advanced technique. Just 2 syringes, and the result after 1 month. And then this one is 4 syringes. After 1 month after the treatment, her face look better, smaller, and also more and younger. And you can see the result of the lifting of Elance for 4 syringes after 1 month. The lifting effect, and here you can see. And if you notice, her eye lift, and also her eyebrow opened, and you can see the double eyelid obviously compared to before after the treatment with Elance. And this is the forehead after the treatment. 2 syringes per total forehead area. You can see, for me, in my opinion, Elance is a very fantastic product for the forehead also. It's very good after the treatment. This immediate, right away after the treatment. And this also the result right away after the treatment. So anyway, I will keep updated about the result of all the cases that I show. So in my opinion, Elongse is one of the best product. It combines the two material, CMC and PCL, which provide the immediate lifting and sustained lifting in the future with PCL. Thank you very much.
I would want to spend a few minutes clarify something for all of you. For those of you who look at the screen on these sides, you might thought that the after picture looks too good to be true. And it's too good to be true because of the defect on the screen resolution. All of our speakers, did not really, how would I say, revise the pictures or edit or modify the picture to make it looks good. But it's because of the screen resolution. So which means if you look at on the screen, the other side, the shape of the facial shape, you will see the real improvement. Not on this one. I'm so sorry for that. And then I already talked to the AV team. Hopefully they will resolve this issue. But of course, we may have time, like a few minutes for the Q&A if you want to. If not, I would like to ask each of the speaker for just one quick question. Elongse, what is the best indication in your hands? Shangli.
I would say,
Can we have the microphone for? And yes, I do.
I would say the skeletal support and the interfascial plane. The deeper plane is without doubt the most important.
Okay, so deep plane, interfascial one. How about you, Dr. Kim?
Yeah. I think the Alliance is first choice of the lifting and the control, simultaneously improving one patient is most best choice. I indicate my personal indication is some patient is on looking fatigue and some sagging, and this patient is I recommend the first Alliance, L code, sometimes C code, together.
Okay, last one.
I will talk briefly. For me, I think Elongse is a good product for the facial lifting without obvious volumizing on the face. That's it.
All right. Thank you very much. Again, last but not least, I would like to thank SINCLAIR for hosting this wonderful workshop, and thank you all for coming in. Please give a big round of applause to all the three speakers. Thank you very much. And if you had more questions, our speaker will be still in front of the room in case if you want to ask more questions. But if not, please stay for my dear friend, Ophia RC, and my sister, Dr. Wanrawi. Thank you.